Ms. Ross, can you tell us, why do unions support this bill?
Well, right now there's at least 9.3 million unions that represent union workers that do want Medicare for all. And I think if you look back at our history, we're to the point now where we can't negotiate anymore for better wages and working conditions, pension benefits, because everything is taken up with bargaining for health care. If you look at most of the strikes across the country in the last several years, they've all been over health care benefits. So I think we see the handwriting on the wall. And also, I know union workers who might like to switch jobs, but they're afraid to because they've got their insurance tied to their employer.
Our nation's healthcare system is the most expensive in the world. Contemplate that. This year, we will spend almost $3.9 trillion, or 18% of our GDP, on healthcare expenditures, and that is almost double what every other industrialized country in the world spends. Over the next decade, our current healthcare system will cost America about $55 trillion. What does that astronomical spending get us? The highest maternal and child mortality rates among our peer countries and the lowest life expectancy. It gets us 500,000 Americans who every year are forced into bankruptcy because of medical costs. It gets us 70 million people who still remain uninsured or underinsured. And that is just a bad deal. Why is America so far behind our peer countries? You might ask that. Because profit-making motives are baked into our system, and our healthcare system incentivizes putting profits over patients. For-profit insurance companies with extremely high administrative waste stand between Americans and good quality, affordable healthcare. I want to be clear that every study, including the Koch brothers conservative study, says that we will save money with a Medicare for All plan. American families will pay 14% less than they currently pay in healthcare costs. And that's why over 250 economists sent a letter to Congress saying that Medicare for All is the right plan for our economy. It's why former CMS administrator under President Obama, Don Berwick, said that after being the director of Medicare for Some, he now believes it's time for Medicare for All. And it's why 30 unions, for the first time, don't listen to the arguments that unions don't want this. For the first time, 30 unions, including the major unions in our country, have supported this bill. Now, it is up to us, and it is time for us to pass Medicare for All. I'm just listening to my mentor, Rosa DeLauro, who took a minute more.
Regular order, regular order.
Say that it is time for us to pass Medicare for All. Thank you, Madam Chair.